I'll be talking about chest X-ray in acute abdomen. It is an indispensable investigation as far as acute abdomen is concerned. And once we have the chest X-ray, so what to look for, and how do we go about looking at an X-ray? So this is a chest X-ray of a female patient, 35 years old, who had presented with acute abdomen in the emergency. And when we exactly see an X-ray, it should be seen with the following mnemonic in the mind: A, B, C, D, E. So A is for airways. So airways, it starts from this X-ray we can see this is the trachea, और ये trachea सीधे नीचे आ रहा है, and this is the carina. And in the trachea bifurcates into right main bronchus and the left main bronchus. And then you look for the parenchymal ear spaces. To parenchymal ear spaces, you see in between the ribs. You look at the diamonds over here, diamonds, all the diamonds that you can see. So ये क्या हो रहा है यहाँ पे कि these diamonds are looking neat and clean, and you also have to look for the lung margins, whether these bronchovascular margins are extending up to the end of the pleural line. So this is for A is for the ear spaces. What is B for? B is for the bones. So you have to look for any fractures in the ribs, any lytic lesions, which will be a hallmark of metastatic disease. तो bones यहाँ पे बिल्कुल ठीक ठाक लग रहे हैं. And what does C stands for? C is for the cardiac size. C is for the cardiac size, and two angles, the cardiophrenic, this cardiac, heart, and the diaphragm, cardiophrenic angle. And this is the costophrenic angle. So you have to look for pleural effusion, you have to look for any retrocardiac shadows, and this should be always be an acute angle. Okay, so these are the two cardiophrenic angle and the cardiac size. So what does the D stands for? The D stands for the domes of the diaphragm. So in this case, when you see the dome of the diaphragm, there is an underlying, what is this? This is the gas under diaphragm. There is a gas over here. So what does this gas suggest? We'll talk about it. And after D comes E. What are E? E are extras. What extras you can see in a chest X-ray? You can see a central line. If a person has been put with a central line, you can see a central line. The central line must be looking like a radio opaque line coming over here. Then there can be a Ryle's tube which will be going up to the fundic gas. Then there may be ECG leads connected over here, here, and there will be this wires going away from here. Okay, so this is the extras that you have to look for. So when do you find? So coming back to our patient over here, see he had gas under diaphragm. So what are the causes of gas under diaphragm? It can be pneumoperitoneum because of a post-operative or iatrogenic cause if she has undergone a laparotomy or a laparoscopic surgery. Hollow viscous perforation, GI perforation. So what perforates? Duodenal ulcers, then appendicitis, then there may be multiple other causes of a perforation. So always remember, anterior duodenal ulcer perforates and posterior duodenal ulcer bleeds. Ruptured liver abscesses after scuba diving, incompetent sphincter of Oddi, and Chilaiditi syndrome. What is Chilaiditi syndrome? Chilaiditi syndrome is if this is the dome of the diaphragm and this is the lever, and this is the lever, there is a loop of the colon or the viscous which has got stuck over here. So this gives a false impression of gas under diaphragm. Okay, so these are the very common causes of gas under diaphragm. Thank you for watching.